Thank you very much, Martin, for introduction, and it's a really pleasure to be with you, colleagues. But unfortunately, I couldn't manage, to come in person, which I really love to do. And but I hope I can contribute to your day to day and give you some flash of the on the digital health development, which I, as Martin, strongly believe is a turning point in the number of fields of our work. My plan is to focus on some trends on concepts of digital health, which I found important, but also introduced to the EU work, European Commission, Parliament in this field, and leave as much as we can the space for questions and answers. I had a chance to be in some of these Euro universities during my career, so it's happy also to reconnect with some of you. So still remember my summer practice in Bordeaux in 1984. It seems like a long time, century ago, but it was really it's really great to be back in the university environment. So let's me go to my presentation. Okay. So where we are, in digital health is a reality. So let's move to the first important, points which I like to clarify. How EU health policy is managed. Where is our scope? Of course, as we know, the concept of health and the responsibility of EU as whole is defined by Article 168, which is basically defining, what we can do, what we have to do, but also where is the interaction between the member states of the EU and the way EU as whole has to interact. So in one hand, we have even checked this potential during the COVID crisis and pandemics. So when we have seen, how difficult it is to work together, but also we understood that this part also should be a little bit reform and done better. So what we did, and we hope we are better prepared for next pandemics. But at the same time, we respect the kind of autonomy of member states to define their own health policy and especially delivery of health services. But of course, as in the complex organization, the crossroads are coming, and almost every day. What is important part of our work is legislation, but I would like to also make sure that the legislation is not dominating our work, because we are not only producer of legislation, but we are also policy makers. So this policy making can be done by software tools like Commission communication, for example. The one which is coming in a few days would be around the mental health. But also through the council recommendation, which, for example, next one coming, we adopted in 3 weeks, will be around the antimicrobial resistance, the new kind of opening in this field by the Commission member states together. But also we have the financial tools and the instruments to support work across EU. The biggest tool we have in the hands of DG SANTE, I am representing, which is health department, also working in the field of food safety, with EU for Health program, which is in this turn of the budget is relatively big compared to the previous years because of kind of pushed by COVID again. But of course, there's something you are very familiar with, Horizon Europe, especially health cluster, which we also are creating with our colleagues from DG Research, but the other programs like Digital Europe, which, for example, is important in the area we are going to discuss. I'm not going to go through all parts of our regulatory fields, but what is important to say, especially in this moment, we really are able to kind of reshape our regulatory frameworks. The biggest package which we just launched and presented to Council Parliament. Happened just 2 weeks ago. Sorry, now it must be almost a month ago, in the pharma field, but also we have important implementing areas like medical devices, which is linked to our work on digital health. But there are other big areas in the implementation, like clinical trials, which was mentioned so by Martin as an important part of our European agenda, which is much more connecting, our clinical trials projects than we used to have before. But the big area of our new challenge, which I'm going to focus in my presentation, is European health data space regulation. We set up I think the most important part of our work in digital health, but especially in the health data, which is going to really change the future of our work in research, innovation, and also patients' care and clinical practice. But let's go step by step. When we started this journey with the digital health, it's reminded me the story which my friend told me. She was somewhere in South America, and the guide, tourist guide, showed them these two birds with blue feet, as you can see on the picture. And one tourist asked question, why they have those blue feet? And the guide answered the question, why not? And of course, this is the moment when we also started to think ourselves, can we really challenge, the way we see the future policies in digital health and care. And it was a momentum, a few years ago, we as a commission, focused on this agenda. We did some studies, some additional surveys, trying to understand what citizens want, what healthcare industry wants, what health professional wants, and we created this agenda. As I said, we have this so-called soft policies, which was one of those in 2018, together with my team, with the team colleagues from DG Connect, we're able to shape this new area, which basically we put in 3 pillars, defining the secure access exchange of health data for research and personalized medicine, and then also how we support the development of digital tools and data for this and empower person-centered healthcare. And when we had this moment, we thought, okay, let's be more ambitious on data and try to make the also GDPR, which was already in place, be more kind of applicable to the health sector, but it was still beginning of this journey. And what's happened, which I don't have slide, but everybody remember, we got the COVID, and COVID really was the biggest trigger for digitalization, not only in the health sector, not only in the thinking about data, the way we organize our work, as we can do this even today, and so on. So this was a big trigger of work. But of course, when you see this more from the way that we believe the transformation of the healthcare should happen, we always ask ourselves, what are the hopes in this digitalization process? What is the purpose? Do we get really personalized treatment? Do we improve diagnostics? Can we do better prevention? Can we also increase access and reduce inequalities, or we will make them even worse? And of course, and finally, there's also a big question, can we really make our resources working better? I was invited by Lancet and Financial Times Commission, which was created in 2019 to reflect together with a number of fellows from different parts of the world and organizations about the future of digital health, and we had this target 2030. We started just before pandemics, and I still remember our focus was so much on telemedicine and the way future services can be done in a country like Africa, but also in the United States or Europe, Australia, and China and India, and of course the big question was about the access and why it can be done or not done, and we created this pyramid of different important parts which again are, we believe, that really give some conceptual thinking in this field. If you would like to see the report of our commission, please have a look on the publication in Lancet from end of October 2021, where we show how digital health is really turning different aspects, that even you can see this as a kind of from the human rights, but also from the access to the services, but also how important is governance, how important, of course, are data. But the shift from telemedicine to data, and thinking about data as a main target, health data was a major kind of challenge for us as a commission. So I think it's very much welcome to read this paper. There's some community in this work, but hopefully we will see more in coming year or two. So when we think about the gaps, to bridge, from this hopes to the reality, so of course there are many. We can start from issues like responsibility. How we're responsible to in this world of digital health. Of course, data quality, but also volume of data, especially when we go to the AI. Integrating digital approaches. You cannot make digital health if you don't have access to internet, if you don't have a relatively cheap access to internet and easy access to internet. Keeping pace is important, because we have seen in many projects that things are started and closed and moved to the different platforms, concepts, and so on. So this is other, of course, funding is an important issue. Security, we have seen a number of cyber attacks on our system, health systems, not only in the United States, but also in Europe. I think Irish colleagues can tell us about one of those, but we have, of course, we'll see more and more. Interoperability is a big issue in the health sector. We created this digital solutions or e-health solutions from different kind of concept platforms against, and now connecting is a big issue. Liability started to be the problem, especially when we move to AI field, but even to the regular data sharing and management concepts. So integrating training, upskilling is a big issue. I'm sure that you will discuss in your meeting today. But of course, trust, I put this as other important break in the system, which can push or undermine our efforts. I try to simplify where we are in this game, especially between the doctors, machines, and patients, and this is simple model, and I hope it's going to help you to see this trig, how we interact, but where is the place, which is really turning our decisions as a physicians or health professionals in general, but also patients' decisions, because patients are changing their roles. They have access to own data, they have access to also to other sources of knowledge. And of course, we have machines now. They are coming into the picture much stronger than even a few years ago when this journey started. And I think the current debate around artificial intelligence triggered by development or publications of new tools it's showing, you know, how this can be sensitive, how it's opening kind of new frontiers of this debate. Oh, sorry. I'll give you one example, which I think is very interesting to have a look. I don't know if you're familiar, but with the concept, which is European Reference Networks. This is the our European ways of helping for patients with rare diseases. So we're able to create those networks, 24 networks, over 250 hospitals across Europe, almost 2,000 clinical centers working together. And this is interesting that, of course, you know, the way the system could be activated is very much also on the e-learning, e-training, the consultation platform, which allow international or multinational panels set up. But of course, you know, generation of knowledge, but also generation of different tools like registries and so on. So this is a very practical example that Europe can work together. And this is just system, you know, how we work, you know, how the advice is in the core of this network. The networks are not project based; they are based on the directive which was finalized in 2020, in 2011, and allowed us this big project to work. And now they are in the 6th year of grow, and hopefully they will continue successful development. So can we do more with the digital tools? You know, most probably yes, and this type of networking is helping. Training, I don't need to spend more time on this. You know, we had a meeting with the deans of School of Medicines in Erasmus Medical Centers in 2019, and you know, it was really clear in this meeting that we have to do the reform of our curricula, rethink our way of working, not only with undergraduate students, but also in the postgraduate programs. And we see, of course, now after those years of pandemics that it's must. So, you know, these two reports, I mean, the Doppler review, which was done by NHS UK, I think it's a very nice example. But I also refer you to one of my favorite book, you know, The Digital Doctor, which is also telling the stories, you know, how things can be developed. Okay, now we are coming to the big reform of regulatory reform we propose, which is, of course, you know, triggered by the questions about the future of role of data in our economy, in our future lives and professionals development. European health data space, you know, this was really the trigger by, in one hand, by our thinking already 2018 and our research this time, but because of COVID, we understood there is a good momentum to put this on the table. Successful story, which you are familiar, as most of European citizens, when we are able in very short time created the COVID certificates, you know, they were recognized created by different centers that vaccines happened, and then they were able to be recognized across Europe in different places when they were asked to be showed, you know. So this showed that we can do, you know, huge projects together in a relatively short time. Already earlier we started, you know, important developments with member states, but now we go to the legislation. This legislation is very much on two or three pillars. You know, the first pillar is the primary health data. You know, how we can make them work better with better quality, standardized way, and how we can create so-called European electronic health record exchange formats. Basically, how we can move, you know, services in this field, new type of products like digital products, which we see them coming, you know, every country, from different startup creation and you know, big companies and so on. Then the second pillar is around the reuse of health data, And this is, of course, mainly for the research, for innovations, for policy making as well. So basically, how we create this those access and permits and secure environment for those data to be used, to be transferred. And of course, under we have the legislation, governance, quality of data infrastructure, and of course, the whole capacity building exercise which still is ahead of us. So this is about the concept, how this can be seen, from the in one hand, empower of individuals, patients or citizens. We speak about vaccination. We feel more citizens than patients. But of course, how this can help, to move our data culture, the way of making decisions and do research in the future, and of course, how we can unleash the potential of data economy is a general approach European Union is taking on in many other fields. So the scope is quite clear, at least for us as a Commission. We really would like to make sure that this regulatory framework is also enabled to move both primary and secondary health data across borders. So when we go to the primary use of data, so of course this embedding of people, citizens and patients to control their data, to share those data with health professionals, but also to basically make them move, when patients is moving. Of course, the important parts is health professionals, but also healthcare infrastructure, healthcare providers. They really can get access, to a given time, and this standardization of this EU formatting is also must. So we are ready. Is not only in the regulatory framework. We are also building infrastructure. It's called myhealth.eu. Now we have able to connect 11 countries. You see that on the map. This year we'll have newcomers like you see them again on the list. So by 2025, we hope the whole EU member states will be connected to the system. This allowed, how this works. The data from the country A, and now we have only two projects, where one is in patient summary, and the other is in e-prescriptions, can be shared through national points. They go to the kind of central services. You don't see those, but they exist. They help with the terminologies, configuration, etc. And they are translated into the languages of the country when patients is arriving. So in the future, we would like to add additional services, so basically laboratory system, medical imaging, but also future one will be for the hospital discharge letters as well. So this is in practical term, patients doesn't see this, how this is functioning. So everything is done in the digital space. So your prescription, I think now already we see this in countries like Estonia or Finland. Patients moving from one country to other doesn't see basically difference, when it goes to the pharmacy in other countries. Is getting easy his or her medications. So the roadmap is quite ambitious. Let's see how we will continue. As I explained, the regulation is under negotiations. Will help us with all rights and definitions, and explaining many things. The pilot of patients' access is in preparation. So we would like to trigger this in next. End of this year, hopefully we will see more results of this exercise. The new services like lab results will be introduced in 2025, medical images in 2026, hospital discharges report 2026 as well. So, but you can see now on our website, how these things are developing, because there's a lot of work behind the scene. We also are trying to use the experience from digital certificates, which we call this EU DCC technology, to help with the easiest use of data across borders. Secondaries of data, it's other type of challenge. We believe this will help with a lot, as I already mentioned, with policy making, with access for researchers, for innovators, and so on. So you can imagine many potential, but I'm sure that you are aware of this concept. So here again, we are speaking about the federated data systems with so-called health data access body, but also with important data holders. So data holder is a hospital, is a clinic, but there are also other sources of data. And the exchange will be done through the special permits and so on. So generally speaking, we have the system which if you see this from the research point of view, you develop some data and your research projects. The data can be available to others. But of course, through the permits and through other means, there's also about the analysis of data and even sometimes ethical concerns, which could be defined by ethics committees. We are piloting this again. This is a very practical exercise as we are negotiating the future framework. We also triggered last year so-called Health Data EU pilot with a few countries that are in red on this map, and a number of networks, but also we invited two important agencies in the European sphere, which is European Medicine Agencies from Amsterdam and ECDC from Stockholm. So this allow us to test the concept of cross-border use cases, because already in the national level, like in Finland, Germany, or France, we already see a number of kind of projects, but also experience with this field. So we defined our network defined finally 5 use cases. One is around antimicrobial resistance surveillance. It's done together with ECDC. European Medicine Agency wants to check, how this may work better in the field of the risk of coagulation disorder in patients with COVID-19. As you know, this was an important issue during the COVID vaccinations. Then the other one will be around the use case, will be chaired by Belgium authority, SANTE, hospitalization, vaccination, adherence in vulnerable subpopulations. The fourth one is about the anticipation of pathways in cardiometabolic disease using AI, which is done coordinated by French hub. And the last one is about the genomic signature characteristics with different types of colorectal cancer, with this coordinated by research network. Must be you are familiar with Elixir. So this is the way we are trying to explore different ways of working through different paths and also see the access of data and so on. Other example on the EU River, which is example of project which was agreed by us as regulators, speaking about the Council, the Parliament, and European Commission, through the new mandate of European Medicine Agencies. But EMA is now trying to use the big data concept in the real world data in the new way of assessing medicines. Of course, it started from pharmacovigilance quite successfully. Now they are moving also to assessment of new medicines. So those real world data in assessment of medicines are already practicing by EMA and partners. And we will move in the new legislation, the package already mentioned in pharma. This will be more structured way. I'm going now slowly to the end. The big issue, which I already mentioned in my beginning, my speech, is about the security. And here really we try to make sure that the security angle, which is very much, and also in the trust of the system, is also covered by this legislation, by infrastructure we're building, by the way the system is working. Access to the third countries often is coming, as a big question, especially, how we can share data, both our primary data when we would like to move our dossier to let's say, to be consulted by US clinic. It's also defined by this legislation, but also secondary use of data. This is as I put on the slide, the Commission proposal. It may change because negotiations are going on, but we hope we will go more or less the same direction, that it's allowed under conditions that will be agreed by co-legislators. We don't need to discuss in this moment AI, because AI is ready to trigger a lot of questions. I said this is the famous game with the computer when unfortunately human lost, and this is of course big questions about the way we will try to manage the AI system in future. Commission has also made a proposal, which is again under discussion in the European Parliament and European Council, how AI should be regulated, and solution in healthcare. In this concept of our proposal, it's belong to the high risk AI solutions, and of course there are a number of provisions how they can be integrated to our world. But it's also important that how they interact with the data and quality of data are of course are keys. There are many questions. Can we do it? And I put some of them. We'll also discuss next week in Dublin about the skill of capacity, data quality, data culture. Can we use data? Why we generate data? How we can use them? How they increase our capacity to work, to make our clinical decisions or policy decisions better. Why we should collect data at all. Resources and funding. Resources and funding is a big issue, as I already said. There's a lot of calls. We need more money. We need more resources. There are money allocated to different programs already in the government level or on the EU level as well. The access to data, governance of data is other big issues. Closing the gap also between the loop, between the secondary data and frontline patients care. How really we can make sure those data are good quality and accessible, but also education, communication, and so on. So many questions ahead of us. I hope it's give you good story, and my personal story is also that you really have to never give up. When we believe in something, you want to get somewhere, you make sure that you can do things as you want. This was my just comment to our commission of Lancet when I really committed myself to the journey in 2019, and I hope continue also with you if it's allowed. So thank you very much, and I am ready for questions.